Good morning everyone. Today, on behalf of the Health and Family Welfare Wing Divisional Railway Hospital Malda, we are going to give a brief seminar on World Hepatitis Day for the for the railway passengers and common people as well as railway beneficiary. Every year on 28th July is all over world it is celebrated as World Hepatitis Day to bring the awareness. The day is actually the fixed as per the birthday of the Nobel Prize winning the Dr. Bouchard Bloomberg in 1976, who discovered the hepatitis B virus HBV and developed a diagnostic test and vaccine for the virus. And we have to keep in mind that we have only one life as well as only one liver, unlike the other organs like kidney and eye. We have there which are two in our body, we have only one liver, so it is so much precious. So in brief, coming in the functions of our liver, it is the largest organ of our body and weighing 1 to 1.5 kg and representing 1.5 to 2.5% of the lean body mass. And the hepatocytes, that is the liver cell, they perform numerous vital roles in maintaining hemostasis, that is the coagulation of the blood in our body following a minor trauma or major trauma, and health and synthesis of multiple essential serum proteins, albumin carrier protein, coagulation factor, and many hormonal and growth factors also produced from the liver. And it forms in the bile that helps in fat metabolism. It helps in digestion of the fat substance, and it also helps in regulation of the nutrients, glucose, glycogen, glycogenolysis, and storage of the multiple vital parts of our body. So in brief, coming to the disease burden around the globe, 350 million people around the globe are living with a chronic viral hepatitis infection. The combined hepatitis B and C causes 1.1 million deaths and 3 million new infection everywhere, and 3,000 people die from hepatitis every day, and over 8,000 new hepatitis B and C infection occur each day. And if the current trajectory continues, the viral hepatitis will kill more people annually than malaria, tuberculosis, and HIV/AIDS combined by 2040. So in brief, the disease burden, actually the problem is majority of the people remains undiagnosed. Incidentally, before the surgery, when there is a routine screening of hepatitis B and C, they become diagnosed and treatment is started. So this is the main problem. Majority of the persons with hepatitis B C infection remains asymptomatic in the initial part, and later on incidentally during routine screening they becomes diagnosed. So only 10% of the people with chronic hepatitis B are diagnosed, and only 22% of those receive treatment. That is just 2% of the total global health burden of this disease. So we need to very much cautious and stress upon the screening, and only 21% people with hepatitis C are diagnosed, and 62% of this diagnosed to receive treatment to cure them, and just 13% of the total global health burden remains treated of this disease. Coming to the risk factor, the factors responsible for causing the disease: travel to developing area of the world, that is the endemic area; exposure to person with jaundice; tattooing and body piercing, which are common habit of our rituals in our system; and history of ingestion of the drug use; and family history of hepatitis, liver disease, and liver cancer; and history of sexual activity is of particular importance. Sexual exposure of common mode of spread hepatitis B, D, and uncommonly hepatitis C, and maternal infant transmission occurs with both hepatitis B and C infection cases. So coming to the symptoms and signs, so that common people becomes aware of this disease when it is happening in the initial part: anorexia, that is the loss of appetite; nausea, vomiting, fatigue; malaise, arthalgia, myalgia; fever; dark urine, yellowish discoloration of the eye; weight loss. These are the common signs and symptoms. Complication is also important, that is if the disease is untreated, what it can lead. So it can lead to acute or subacute hepatic necrosis, the liver become completely damaged; chronic hepatitis, cirrhosis, liver failure, and hepatocellular carcinoma in hepatitis B and C infection particularly. So whenever there is a problem, there should be stress regarding the prevention. So once the disease is affected, it is very difficult to cure. Long term medication is required. So in hepatitis B, as it is transmitted by fecal route, so adopting, taking clean drinking water, safe disposal of human excreta, and hygienic precaution, and the unvaccinated persons, the vaccine is available against hepatitis B. So these are hepatitis A. So the common mode of prevention. Coming to the hepatitis B, screening of transfused blood products for hepatitis B surface antigen, single use of needles and syringe is also doing we in the healthcare personnel, and precaution against the hospital acquired nosocomial infection, and practicing safe sex, the barrier method, is also important. The vaccine is also available in hepatitis B 3 doses at the interval of 0-1-6 months, commercially available as Engerix B, Hep B, provide protective antibiotics in more than 95% of the recipient, and in post-exposure prophylaxis, that is the persons already exposed to hepatitis B viral infected needle or blood product. Those who have not vaccinated can take the vaccine following the exposure at the interval of 0, 1 and 2 months and followed by a fourth dose at 12 months to prevent the development of this disease. And the immunoglobulin is also quite efficient. Hepatitis C, the prevention of hepatitis B and C are quite similar, so not going to tell. The hepatitis E and A are quite similar, so safe clean drinking water, safe disposal of excreta also helpful. So coming to the last part of our seminar, that is the take home message. So many hepatitis death could be prevented by simple screening and early diagnosis treatment, and because these vaccines against hepatitis A, B, C are quite effective and treatment for hepatitis B, so vaccination, adoption of vaccination especially for the high risk person like healthcare worker is also important, and you can protect yourself and your loved one. Thank you.